I am performing hand hygiene. Hi, my name is Kareli. I'm gonna be your provider today. Before we start, I just wanted to get your consent for me to record this meeting and to upload this video to YouTube for my class.
It's okay.
Okay. Today I'm gonna be performing a head examination. I'm gonna be looking at your eyes, at your ears, nose, mouth, and neck. Okay, I'm gonna start by looking at the patient's hair. The patient hair is average texture. There's no fine hair, no coarse hair, and there are no rashes, no lesions noted. The head is also normocephalic, atraumatic. And right now I'm gonna start touching your head, okay? So when upon palpation, there are no cysts, no masses, no depressions, and no hematomas. Do you feel any pain?
No.
Okay, so that's the normal test. Next, I'm gonna proceed. I'm gonna check your eye visual acuity. Okay, I'm gonna use my Snellen chart, and I'm gonna be 6 feet away from the patient, and I am going to ask the patient, can you cover your right eye, please? And read the smallest line you can.
C F G H J.
Okay, and now cover the next eye.
L T F E R.
Okay, with both eyes.
L T Z. I'm sorry. L T E Z M.
Okay, and the patient's exam results in a visual acuity of 20/20 bilaterally, and thank you for that. I'm gonna change, and I'm going to evaluate, and I'm gonna see your eyes and your eyebrows. The hair is spread evenly. I'm gonna take your glasses off, okay? The eyelids are not inflamed, and the sclera is white, the iris is normal, the cornea is normal as well, and I am gonna touch you, and I'm gonna check the conjunctiva is pink, the lacrimal gland is not inflamed, and the lacrimal sac, and there is no excess tears. Okay, thank you for that. Now I'm gonna use my pen line, and we are going to look at the pupil reaction to light. Okay, I'm gonna ask you to look at me, and I'm gonna check in direct manner first, which means that I'm gonna light the light to your left eye, and I'm gonna be evaluating that eye, which is the left. Okay, so look at straight forward, and I'm gonna do the same right light, and then right eye, and then that's the direct manner. And now I'm gonna do indirect, which is that I'm gonna position the light to your left eye, and I'm gonna be looking at the opposite light. Okay, and then the other side. Okay, so both pupils react brisk and goes from 5 millimeters to 4 millimeters with the light, and that is within normal limits with direct and indirect. The next step I'm gonna ask you to do is I'm gonna check your eye movements, and I'm gonna ask you to look at the pen, and I'm gonna ask you to follow my pen. With this exam, I'm gonna be evaluating cranial nerves number 3, 4, and 6, and I'm gonna be saying them as we do the movements. Okay, so just follow my pen line, and I'm gonna go diagonal, and that's number 3, and then back to the middle, and then the other diagonal, and that's number 3 to the middle, diagonal up, and that's number 3 to the middle, and then diagonal down, that's number 4 to the middle, and to the side is number 6, and I did not notice nystagmus, and that is normal. I was evaluating the left eye, so now I'm gonna evaluate the opposite eye. Okay, so same procedure. So I'm gonna go up, and that's cranial nerve number 3, and then diagonal, cranial nerve number 3, and then the other diagonal, cranial nerve number 3, back to the middle towards the nose, and number 4, cranial nerve number 4, to the middle and to the side, that is cranial nerve number 6. No nystagmus was noted. Now I'm gonna test for convergence, which is that the pen light, I'm gonna ask you to follow the pen light, and I'm gonna be evaluating the patient's eyesight is gonna go towards the pen, towards the middle, as we go closer to the nose bridge. Okay, just follow the pen light. Okay, and that was normal. Both eyes went inside and follow the pen light. Now I'm gonna do accommodation of the pupil, which is that the patient is able to focus on a near object and then focus on a far away object. So I'm gonna place my pen light, and please focus on the pen light, and then focus on me, and then focus on the pen light again, and there was good accumulation of the pupil. The next step that I'm gonna do is I'm gonna ask you to stand up, and I'm gonna test your visual fields. Okay, so I'm gonna be 2 feet away from the patient, and I'm gonna ask him to cover his right eye, and I'm gonna mirror the patient, and I'm gonna cover my left eye, and I'm gonna be wiggling my fingers. Let me know when you see both fingers. Okay, ready?
Now.
Okay, and then again.
Now.
Okay, and then again.
Now.
Okay, and then we're gonna do the next eye. Can you cover? And then I'm gonna mirror the patient. And
now.
Okay.
Now.
Okay.
Now.
Okay. Thank you for that. The visual fields are within normal limits, and you can ask you to sit down, please. Thank you for that. And then for the next exam, I'm gonna be doing the ophthalmoscopic exam, and I'm gonna be dimming the lights for that exam. I'm gonna grab this and gonna turn it on. So the safety is I'm gonna use my right eye for the patient's left eye, and I'm gonna use my fingers to stop me from going forward when I'm that close to the patient, and I'm gonna grab the patient's head with the other hand. And first thing I'm gonna do is I'm gonna find the patient's pupil, and then go in, and then I find the red reflex, and I look at the optic disc and the optic cup. The color is yellow, yellowish orange, and I evaluate the margins, which are sharp, and I evaluate the arteries. There are no hemorrhages noted and no cotton wool spots. Okay, thank you for that. When I'm doing on the opposite eye, I'm gonna do it same like opposite eye, and then the fingers, and I'm gonna be holding the patient's head, and I locate the pupil, and then I go in, and I locate the red reflex and go towards middle to look at the optic disc and the cup. There is no cotton wool spots. The optic disc is yellow orange, and the margins are sharp, and the arteries, I look at them and there are no hemorrhages noted. Okay, thank you for that. So now I'm gonna proceed to the patient's nose, and I'm gonna give him back his glasses. For the patient's nose, the first thing that I'm gonna do is I am going to look at the nose, and the nose is midline, it's not deviated, there are no rashes, no lesions, there is no apparent drainage from it. And I'm gonna ask you to cover one of your nostrils and take a breath in and out. And this is to check patency of the nostrils, and then do the other one, please. Again, we are checking for patency. Both nostrils are patent. And the other test that I'm gonna do is I'm gonna test your smell. So I'm gonna ask you to close your eyes. I'm gonna ask you to cover one of your nostrils. Cover one of your nostrils, please. Close your eyes. And then tell me what you're smelling.
Coffee.
Okay. And now the other nostril. What you're smelling?
Cinnamon.
Perfect, thank you. So that means that the patient's smell is normal, which shows for cranial nerve number 8, I believe. Okay, now I'm gonna look at the patient's nose from the inside, and I'm gonna grab an instrument and I'm gonna ask you to look up. Okay, and I am looking at the turbinate, and it's not swollen. It is, the membranes are pink. The septum is not deviated and not perforated, and there is no drainage noted. I'm gonna go to the other side and look at the same, which is that the mucus are pink, the membranes are pink, sorry. There's no drainage, there's no lesions, the septum is midline, not perforated, so it looks within normal. Another test from the nose is to palpate for the sinuses, so, and the nose. So let me know if you feel any pain, okay? Any pain?
No.
So now I'm gonna palpate the maxillary sinuses. Any pain?
No.
And the frontal sinuses. Any pain?
No.
Okay, thank you. Now the nose examination is over, and I'm gonna proceed to the ear examination. For that, I'm gonna ask you to come forward, please, on the chair.
Oh.
And I'm gonna be 2 feet away from the patient, and I'm gonna test for auditory acuity, and I am going to ask the patient, can you cover this ear, please? And I'm gonna whisper a 2-syllable word.
Apple.
Okay, and then cover the other, and I'm gonna whisper a 2-syllable word, and please let me know what you hear.
Orange.
Okay, so the auditory acuity is within normal limits. And can I ask you to go back? Thank you. Now I am going to look at the ears, and I'm gonna examine the ear for no clear evidence on not to do the exam, which would mean that there's like blood or drainage, and maybe the ear is inflamed, or there's like something blocking the ear, but there's nothing that I see. So I'm gonna palpate the ear and let me know if it hurts.
No.
Okay, and now I'm gonna look inside the ear. And for an adult, I am going to, for safety as well, I grab the patient. If patient moves, then I'm gonna be blocking the movement, and it's not gonna hurt the patient when I'm doing the exam. And I'm also using my fingers to not let the patient move towards the instrument. So for an adult, it will be up and backwards. And inside the ear, I'm gonna be looking for the tympanic membrane, which is pearly gray, and I also notice the ulmo, and the cone of light is to the 5 o'clock, and there is no redness notice, no inflammation. The ear canal is pink, and that will be the exam. And I'm gonna do the other side of the other ear, and I'm gonna do the same. First I'm gonna look. There's no evidence of drainage or any inflammation. I'm gonna palpate. Do you have any pain?
No.
Okay, and then save is the safety of the patient, and I use my fingers to control the patient's movement, and I put the ear up and back, and I see the tympanic membrane is pearly gray, not perforated. The cone of light is to 7 o'clock, and the ear canal is pink. There is no drainage, and there's no inflammation or redness. Okay, and I'm done with the visual examination of the ear. I am going to do the Weber and the Rhine test. This test, the Weber is gonna be the first one. It tests conductivity, okay? And you're gonna let me know if you hear the sound equal of there, or if there's a side that where you hear it more than the other, okay?
It's the same.
The same? Okay. So now that was the Weber test, and now I am going to do the Rhine test, which tests bone conductivity versus air conductivity, and I'm gonna place it on the back of your ear, which is the mastoid, and let me know when you stop hearing it, okay?
Now.
Can you still hear it?
Yes.
Okay, we're gonna do the other side.
Now.
Do you still hear it?
Yes.
So that means that that was a normal result of this test. And now I'm gonna proceed, and I'm gonna look at your mouth, okay? So the first thing I look is the lips of the patient, and I'm looking for cyanosis, and the patient has no cyanosis. It's pink to around the mouth and the lips. Can you look up and open your mouth? And I'm gonna use just the light, and I look at the membranes. They're moist, it's pink. I look at dentition, which is good. I don't see any cavities. I also look at the gums, and there's no lesions, no sores, no signs of inflammation or infection. They're pink and moist to all of the gums. And also the soft palate. The soft palate is pink, it's moist. There's no drainage or inflammation. Now I'm gonna ask you to stick your tongue out. The tongue is midline, and I'm gonna look at the back of the pharynx. Can you please say ah? And the uvula rises, which is means that cranial nerve 9 and 10 are intact. And I also look at the pharynx. The pharynx is pink, it's not red, not inflamed. The tonsils are not able to see, so that's a normal finding. And the other thing I was gonna do next is I am going to see the neck, okay? So I'm gonna see range of motion of your neck, and you look up and then down and then middle, and go lateral to the other side, and then middle, and then rotate it to the side, and don't let me push you. Perfect. And then to the other side, don't let me push you, Excellent. And I shrug your shoulders. Don't let me push them down. Okay. One of the tests that I skipped from the tongue exam is the strength of your tongue movement, okay? So I'm gonna go back to it, but it's just gonna be one last time, okay? So what I want you to do is I want you to push with your tongue, okay? And then the other side, push my hand, perfect. So that tongue strength is normal. We're gonna go back to the neck. I'm sorry about that. And I look at the trachea. The trachea is midline. There are no masses noted, and there is no bulging, and that is normal. Now I'm gonna proceed and I'm gonna palpate, and I'm gonna palpate your lymph nodes, okay? So I'm gonna see if there's any lymph nodes that are inflamed, or let me know if you feel any pain, okay? So I'm gonna palpate in the back for the occipital lymph nodes, okay? And then the posterior auricular and the auricular, and then the submandibular and the submental. We also have the anterior cervical, and then the posterior cervical, and the supraclavicular, which I didn't notice any inflammation of your lymph nodes, and that is normal. The last test that I'm gonna do is for your thyroid. So I already evaluated from the front side. There are no bulging, no masses, and then I go to the lateral side as well. There is no bulging or no masses noted, and no enlarged thyroid. Can you swallow for me? And I see at the movement there's still no bulging noted. In this part, I'm gonna go behind the patient, and I am going to place my hands in the trachea and locate the thyroid. And then can you swallow for me first, please? Perfect. I'm gonna push it to one side to make sure I didn't miss any masses or enlargement, and then to the other side, and there are no masses or enlargement. And that will be the end of the test. And thank you so much for your time and for your consent for this video.